going for.
Thank you, Scott. Welcome, everybody. Glad to be here tonight. Scott mentioned that I want to talk about the fusion of drugs and sex that is prominent in my life and my research and my therapy. And I think it's just so important. You know, I started as a recovering alcoholic myself. I started as a substance abuse counselor and I got into sex addiction only when I realized my clients who were using a lot of amphetamines were combining with sex, and I didn't know so much about that. And I made the kind of bridge to connect. But I still do a lot of work with the substance abuse counseling field and had the occasion to do a very large webinar training, like I'm talking 600 people last week of primary drug and alcohol counselors. And one of the opportunities I had in the presentation was to do a little poll of the audience and just ask how familiar they were with this pairing of drugs and sex. And to my surprise, about a third of the audience, and pretty closer to 40%, said that they were had very little familiarity with the topic, which is kind of staggering to me. And I think it pointed out a real problem we have in the addiction field that I just want to kind of review tonight, because there's a lot of misconceptions, misbeliefs about what's an addiction and what's not that still lingers, I think, in some quarters. I guess if I had to do a tagline for this kind of topic, it would be the message that I get so many clients coming to me from other therapists who've been told this, or going to treatment centers for addiction and being told this phrase. And the phrase is this: just get clean and sober with your drugs and the sex will take care of itself. Now, if you talk to a Chemsex addict or anybody who's paired any kind of sexual acting out with substances and tell them to just get the alcohol under control or the cocaine or the meth and just don't worry about the rest, you're really setting that person up for disaster. And I think that's what I just kind of want to point out tonight, is that these two things, that fusion is a very real thing, and just kind of lay out in very basic terms kind of how that looks. One of the problems, I think, is that we trained counselors to focus on certain areas, and we trained substance abuse counselors to focus on substance abuse. And I had a mentor once who told me, people find what they're trained to look for. And I think that's true. I think people are looking and finding cocaine and meth and substance abuse because they've been trained to look for it. And they're missing porn, they're missing sex, they're missing gambling, they're missing work, exercise, food, all this stuff that we don't think of as addiction. And so I think that's a real issue. My belief about this is kind of this addiction is this whack-a-mole syndrome, right? I can treat your porn use. Okay, we get that under control. Then it maybe pops up as a little cocaine issue. So we treat the cocaine issue. And then maybe it comes up as gambling. And then maybe it comes up as food. And it just kind of bounces around if we treat each individual individually, as opposed to treating the whole system, the whole unit. And I think that's what we do so well at Seeking Integrity. And honestly, we're one of the few places that do it in that really holistic way. But I think unless we treat that whole system, and by that I mean what's underneath it, what's driving these behaviors. If it's like pulling a weed, I can pull the weed, but if I don't get it out in the ground, it's going to come back. And so what that ground root is, I think, in so much addiction is trauma. And unless we really face that underlying trauma and address it in good time, we have to do the proper sequencing of therapeutic interventions. That's really important. So that's kind of my theme tonight. And I just want to lay out a couple ways these things can be fused. When we mix drugs and alcohol, they can be fused directly, meaning I can be a cocaine user or a meth user, and I combine them with sex and porn. I do it all at the same time. That's classic. That's what I've spent 30 years researching and treating. If we don't treat both sides of that, what happens? If, for example, if we just treat the cocaine or the meth problem without treating the sex, you're going to get half the equation under treatment, and people are going to lead to relapse. Very often, when it's fused like that, you can have a drug craving, a drug trigger that's going to inspire a sex craving, or a sex craving that inspires a drug craving. The two are linked and they're so bound up together, you just can't really treat one without treating the other. And very often, by the way, we have people in program here at Seeking Integrity who've been in recovery from drugs and alcohol for 6, 7, 10 years, but they almost immediately switched over to porn or gambling or spending. I tell the story when I was in recovery early recovery from alcohol. My first anniversary, there were some guys I got sober around the same time I did, and we looked around. I was back to smoking cigarettes because I'd given that up before I bottomed out on alcohol. But I thought, I need something, and cigarettes aren't as bad as alcohol, so I'll do that. And another guy had gained 50 pounds because he just started eating when he couldn't smoke. In fact, the big book, I think, says you take sugar. It'll help those cravings. It does, but it's another problem. Another guy had credit card debt. He just started spending stuff because he deserved it. And so unless we treat all this stuff, it's really problematic. I did want to say there's another way. I talked about chemsex and the fusion. They can also alternate. So we may see somebody who, in that sex addiction cycle, who acts out and is in that remorse phase at the end. They're feeling shame. They're feeling remorse. They've done it again. They've crossed the line. They broke it. They violated the trust of their partner. And so what do they often do? They numb or seek something to soothe the shame, the remorse, the sadness over the addiction for the sexual acting out. So they may turn to alcohol or opioids or tranquilizers or over-the-counter cough medication. I've seen it all. And so, that's just another way of treating it. Unless we recognize that too, that could flare up as a problem. So my bottom line message here is that we really need to recognize that although we may not have training in one area, I think it's incumbent on professionals and the public to really understand this is a big thing, and this has the potential to just move from one thing to another if we don't understand the whole system. And I'll close just with the perfect example. We, for many years, of course, behavioral addictions were controversial because the old hardliners in the drug using community felt that if it wasn't a drug, it could not be an addiction. Well, with better brain science and brain scanning and our ability to read what's really going on in the brain, we know that when you ingest cocaine, your brain looks a certain way. And now we know that when you look at porn, guess what? Your brain looks exactly the same. These are just different ways that human beings can manipulate their own brain chemistry to get a desired effect. And we can do one, we can do the other, we can do both. And so I think it's just so incumbent to not do harm to people by ignoring the fact that these other behaviors can easily become addictions, and suddenly just with all that drive to numb or escape or dissociate or just step out of our lives because of some kind of emotional pain or issue that we want to avoid, we are creative as addicts. We can find all kinds of ways. And if you take away my drugs, I just might find porn or sex or gambling or some other way until we deal with why am I doing this whole thing in the first place. So that's a very quick, speedy kind of summary, a little sermonette of my feelings about this topic. Thank you, Scott.
Thanks, David. Ask us questions, pop them in the Q&A feature, anything to do with the fusion of drugs and sex, or just sex addiction or recovery or addiction in general. We'll be happy to answer all your questions. David, I just want to point out, this was about 500 or 600 addiction treatment specialists. And when you say 40% of them basically admitted to having no clue, these are people who treat addiction on a daily basis.
These are full-time professionals at every level of treatment of skill and academic training. Yeah.
And I think you told me in that survey, like the least high percentage response was people who actually felt like they understood this fusion.
Yeah, that was by far the minority, like less than 20%. I think it was more like 15 or 16%.
Yeah.
Had some comfort.
16%, maybe it's half of them who actually understand it.
Right. Yeah, so, it was astounding.
Yeah, and this is, I've been around both substance and sex recovery for a long time. And, I see people, particularly in my AA program, probably at least half the time, if they relapse, they've relapsed over something to do with sex or relationships. And I always think, maybe you should deal with that part of your life too.
Yeah. And I have the same phenomenon, Scott, in my own AA meetings and my NA meetings. I look around, probably about half the people are sex addicts, but there's kind of a joking dismissal of the fact that it could be a problem. People support each other kind of in that, in their bad behavior. And it's kind of funny, jokey, and it's quite serious, because then very often people relapse on their original problem, which is alcohol or drugs or some other kind of addictive disorder.
Yeah, and once in a while, it's interesting. Once in a while, in a substance abuse meeting, I will actually share a little bit about the fact, I try to stay on topic if I'm in an alcohol meeting or a drug meeting, but I'll share about, I'm also a sex and porn addict. And I'll say, if anybody is struggling with those issues, please come see me after the meeting. And invariably, at least one or two people
I
come and
believe it.
find me after the meeting because they're suffering.
Yeah.
They're no longer joking about it. They're actually suffering because of it.
Yeah.
I have a couple of quick questions, and then we'll jump into the Q&A because they're coming in fast and furious, which is good. So get your questions in early if you want to get them answered today. Chemsex versus fusion of substance sex terminology. Can you explain a little bit about that just real quick?
Yeah. So when I say chemsex, it's kind of a shorthand term for co-occurring drug use and sex. And that's typically amphetamines are by far the kind of friendliest drug class to enhance sexual desire and sexual behavior and functioning, kind of revs the whole thing up and matches very nicely. So we use that as a shorthand term, but chemsex really is a shorthand term that actually the term was coined referring specifically to gay men and the experience of gay men and substances and internalized homophobia and shame and stigma and all that kind of constellation of stuff. And it is a unique profile among gay men. However, gay men do not have any corner in the market of chemsex or co-occurring drug use and sex. My friend David Stewart in the UK actually coined the term, and he wants it to be a gay-related term. So I kind of try to honor that. But it's such a explicit term that people understand what you're talking about. It's hard to not use it as a shorthand. But it really is co-occurring drug use and sex, and we can match any drug with sexual behavior. So it can be alcohol, which actually is not a great drug for sex physiologically, but it disinhibits, or marijuana, even opioids I've seen combined with sex. So really people can mix and match any substance depending on their own issues and their own kind of temperament and desires.
Yeah, and I just want to point out your first book deals with basically gay men who are engaged in chemsex in the traditional way with amphetamines and sexual behavior. The new book you're working on is much broader, looking at all the substances and all the people who do it. That's correct?
Right. Men, women, gay, straight, and really all substances as they combine with sexual behavior. So it's a much broader scope. Yeah.
The other question I have for you is you've talked about the co-occurring, and you mentioned briefly sort of cross addictions where you hop from one to the other to the other to the other. Are the consequences different, or is the treatment different, whether it's a co-occurring fusion or whether it's a cross that really isn't really a fusion, it's just bumping from one to the other to the other?
I think they both require really intensive treatment to start. I think when we have that fusion, the co-occurring part, it can amplify the whole thing and really escalate the intensity and the speed of the addiction and how it develops. So that's one kind of feature of that, as opposed to cross addiction, which can often stabilize into this very long-term pattern. People go on for years, kind of alternating, but eventually both of them, in my experience, kind of get out of balance, and people start to crash and burn and need the support. But I think a program like Seek Integrity would treat both probably pretty equally. As an individual therapist within that context, I might have different emphases and sequencing, but they both pretty much respond to the same kinds of treatment.
Yeah, I think maybe one of the few differences I've ever spotted is, and I'm cross addicted. I went from sex addiction to drugs to alcohol and back. I never really fused them, but one of the differences for me is if I get triggered for my sex addiction, I'm triggered for my sex addiction. I'm not feeling like picking up or drinking. Whereas somebody who's got a co-occurring addiction, any trigger, it triggers all of the addictions at the same time.
Right. The whole system is activated.
One big ball of addiction as opposed to separate addictions.
Exactly. Yeah. And that, I think, that's why people can kind of carry on that alternating cross addiction pattern for longer, because they go from one to the other, and it doesn't kind of escalate as quickly.
Yeah, it takes a little longer for
the
ship to crash.
Right.
At least that's certainly my experience. Okay, let's jump into the Q&A. Pop your stuff into the Q&A rather than chat feature. I go to Q&A first, but I see we've got stuff in the chat feature too. I'll try to take them in order here. Hi, I wanted to thank you for the awareness that trauma resides in the body as well as the mind and cannot be treated by talk therapy alone. I think this goes back to last week. What physical related therapy can be done that helps with trauma? Yoga, EMDR, anything else? I think underneath addiction lies trauma, which we just talked about today. Thanks for your ideas. So dealing with trauma effectively.
Yeah, so great question. And we know without question now that trauma is not just a thing in our mind, it resides in the body and the nervous system of our body. And anybody that's ever had a massage and hit a point where suddenly you were crying or you were laughing, just as a result of that pressure point being released, that is exactly what I'm talking about. And trauma is kind of embedded. Often we get trauma before we're really verbal. You know, our brains are still developing up till we're age 25. So you get a kid who has experiences trauma at age 4, 5, 6. They don't really have a cognitive capacity to make a story out of it. They experience it. And so that all goes right into the system. So if we're trying to address trauma and treat it therapeutically, if we just do talk therapy, we're missing that whole piece that's kind of below our level of consciousness, that has no story. It's just feelings, sensations, pain, old memories. And so for that, we need to have, and I say any really good trauma therapy has that, what we call somatic component. It recognizes the body feature. You mentioned EMDR. EMDR is a great therapy. I do that therapy. It recognizes the physical sensations. You mentioned yoga, which is another one. It's not a therapy per se for trauma, but it certainly helps. And I think it just in terms of getting the body in touch with those things, getting the person in touch with those. There's a whole bunch of them. Somatic experiencing is one. Breath work is another. Breath work is amazing in that it is extended sessions of very rapid breathing, which actually produces kind of an altered state, but it's wonderful for releasing trauma in the body that isn't necessarily a talk experience. It's not a cognitive experience. It's releasing sensations. So I think any of that stuff, any trauma therapy that includes that awareness to the body, brain spotting, which is really just linking up feelings and thoughts in our brain with sensations in our body. You know, and I think oftentimes, and this is true with other areas of recovery from sex addiction, I believe, we have to really start paying attention to our bodies and the sensations and the information, even from a feeling point of view. You know, very often addicts in early recovery don't know what they're feeling. It's really hard to identify it. But if they can start to notice their body and notice what sensation they're experiencing, where, you know, a tightness in their stomach or a pain in their heart or tightness in their throat or temple stress, you know, all those things are information systems, and they're really informationally important for the person to know and identify feelings. So just that body awareness. I think if you just look at a list of trauma therapies, almost all of them have, if they're legitimate trauma therapies, have that somatic component. What I worry about is if you have somebody that's not really a therapist, not really trained in trauma, who is just trying to do plain old talk therapy, that's where it's not going to be very effective. And that's where I think you're actually could be doing harm. Because the other part of trauma therapy I'll just mention is that we have to resource the client, meaning we have to give them tools to help them regulate their emotion, to help them ground themselves again if they're triggered, to help them stabilize themselves. These are all very empowering tools. And this is one of the things I've talked about a lot here in this webinar. When we're doing addiction treatment, and I mentioned, you know, I think trauma is a core underneath it. And so a lot of people just want to get right in there and start working on that trauma. But remember, addiction is a kind of maladaptive coping mechanism to deal with that trauma that we don't want to feel. We don't have to worry about that pain or even be in touch with it. And so if we take away the addiction, which is the coping mechanism, and open the hood, you know, and dig right into that trauma, we're going to cause a lot of emotional pain. I've seen people relapse over therapists doing that too soon. So we have to stage it. And it doesn't have to be a long time. I've seen even 2 or 3 months. But what we do at Seeking Integrity typically is not actually start the trauma therapy, although I think all of us are certified trauma specialists, but we do start the resourcing the client, helping them identify feelings and regulate, giving them tools to ground themselves, to calm themselves, to recenter should they get triggered. And those skills are really useful also for just managing triggers and cravings for the addictive behavior. So it all
You
works.
also do sort of identify and uncover and acknowledge a lot of the trauma without too deeply working on it, just letting people know this is the cause of your addiction. You're going to want to work on it when the time is right.
Right. And I'll just say, very often we get somebody in first couple of days of treatment, really can't identify any trauma. Everything was great childhood. And then, they start remembering stuff, and it may not be that there's, memories they suppressed, but it may be things that didn't happen, like neglect. And that's equally traumatic, where a kid doesn't have the emotional attention, or at least consistent emotional attention from their parent. We call it attunement, where they may be provided for with all those material goods, but they don't have the parent saying "I love you" or showing up for them emotionally or being present emotionally. And that can be that can lead to trauma down the road. So it takes all forms, but usually once people start dropping their denial and their kind of defenses, they start to get in touch more with some of the impact of the experiences they had as kids.
I'll throw out just a couple more things as adjuncts to somatic treatment of trauma: meditation and just stretching, particularly if there's like a stretching class at your gym or something.
Yeah,
many people have done those and found them useful.
Yeah, anything to get us in touch with our body, because very often addicts kind of survive or exist from the neck up, right? We kind of lose touch with our bodies. Even oddly, sex addicts, of course, sexuality is a very physical thing, but often sex addicts are quite numb to a lot of emotional content. It's more of a behavior that's kind of disconnected from feelings in a way. And so it's very important for everybody to kind of reconnect with their body like that. Yeah, great point.
Are there any books for chemsex addicts to learn about its impact on human physiology, mental health, intimacy, and recovery at different stages, ideally focusing on straight men? This is sort of the opposite of the problem David and I, who are both gay men, had when we used to read books about addiction and things.
Right.
We had to take the straight book and make it gay.
Right.
Right now, the book that's out there is Less Men and Meth, which focuses on gay men. But
yeah,
working on a new book. Yeah,
and my book Less Men and Meth is, the case studies in the book are gay men, but the science in the book and the therapy in the book and the issues in the book are universal. And so, and I've had a lot of straight guys, straight women read the book and get a whole lot out of it, because 80% of the book relates to everybody. It's just the case studies are gay men, because that was where I was coming from in my practice. But
I think even the case studies, most straight men can identify with, the feelings and the behaviors, if not the actual partner.
Yeah.
So I would pick that one up and just, read between the lines to make it for you. And then the new book will be out eventually.
Yeah, hopefully by the end of the year. I would say there's one other book, the only other book I'd recommend on chemsex is by a psychiatrist named Stephen Lee, and it's called Overcoming Crystal Meth Addiction. He knows his stuff, and it's a good book. I can't really recommend many others because they're triggering, or they're personal stories, and they're kind of somewhat misinformed. And so I hate to say that, but really those are the two books that I'd recommend for everybody.
Yeah. Is it normal for a sex addict male to be extremely jealous over his female partner to the point of assuming every male likes her or she is attracted to every male as well? He has been like this our entire relationship. We only found out about his sex addiction in February of this year.
I think we see this sometimes. When I see the words extremely jealous, I kind of want to know more about that, because that often goes with kind of controlling behavior, and it's a slippery slope sometimes down into abusive behavior. And so I'm not saying that's the case here, but I think that kind of extreme jealousy is a warning sign, at least, for other things. Now, in and of itself, I think it does go with sex addiction to some extent, although I've not seen it in such kind of stark terms. Maybe it's described here. So I think that might be a kind of pre-existing pattern that's an adjunct or somewhat related to sex addiction, but I don't think it's a necessary component of sex addiction at all. I do think it's a thing to be looked at and talked about, because that kind of jealousy and possessiveness, as I say, can lead to other kinds of difficulties in the relationship. And so if he's taking those feelings and then spinning them into acting out based on that, then it's a direct correlation with his addictive behavior. But I think it's certainly something to look at. If he's in treatment, hopefully he is for his sex addiction treatment, or seeing a therapist, I would certainly bring up this issue as part of that, because that's worrisome to me.
David, can this also be, a lot of sex addicts appear to be very narcissistic, whether they're clinical narcissists or simply behaving that way as a compensatory measure. Can extreme jealousy be linked to that narcissism or narcissistic behavior?
Yeah, so narcissism, as you say, whether it's actually diagnosable or just those tendencies, we see it very commonly with male sex addicts, and probably all sex addicts. And I think it's just that sort of world revolving around me kind of stuff. Everything relates to me. We see this oftentimes with guys when they're trying to understand the experience their wives have had and the trauma they're acting out has had. Often will, once that's pointed out to them through a letter or through anything else, might just kind of feel sad that they caused it, but it's still all about them, as opposed to understanding, the impact on their wives. So with this, I think that possessiveness could be, this is all kind of part of my world. Everything revolves around me. And so, yeah, that could fit into that kind of constellation. Although, again, I think this is a little bit more than just narcissistic behavior. When I see that extreme jealousy, that often is, there's often insecurity in there. It's grounded in other kinds of, I'd say, mistaken beliefs about stuff. And I think it does need to be addressed.
Yeah, I've heard guys say in my work groups and elsewhere, my assumption is that if I'm cheating and sleeping around and flirting with everything with feet, she must be doing the same thing. And guys project their own behavior onto their wives or their partners. And they know that it's a little bit crazy, but they can't stop themselves from doing that. How common is that?
I think that's fairly common. And that's, one of our classic defense mechanisms in addiction and psychology, probably in general, but certainly in addictions, is this idea of projection, where it's like, okay, I'm feeling guilty at some level, probably not consciously, about my behavior. And so I'm kind of throwing off all my behavior. I'm assuming you're doing it too, and I can be angry and upset with you. But it's really kind of my own behavior that I can't see in myself that I'm projecting onto you. And so, yeah, that's pretty common, actually, for sure.
Yeah, I mean, I've heard guys say, like, call their wives horrible names because they think she's sleeping around, whether she is or isn't. And, and I get to look at them and say, and how many women did you sleep with last week,
right,
in your active addiction? So, yeah, it can get a little crazy. This is a comment that came into the chat feature. And I want to read it. And David, if you want to talk about it a little, you can, but I think it's worth reading either way. My husband refused to admit he was an alcoholic and just went cold turkey when I said it was a problem. He was behaving dangerously and acting out with women as well. When he quit alcohol, he ramped up his womanizing and his overspending. Then he started pairing gambling and women, ending in gambling addiction and sex addiction, which ended our family.
I just today went over a diagram with our clients to talk about, it kind of puts addictive behaviors on this continuum from the intensity addictions, to all about arousal, to the kind of satiation side, which is all about kind of numbing and downers kind of behaviors and drugs. But this is so classic, because all the behaviors that this person is talking about are on that arousal side. And my point to the clients just today was that it's so easy to jump from one to the other. And here it is. This is a perfect example of that. Alcohol tends to be on the satiation side, but as I say, people jump back and forth. And so one is just cut off. And by going cold turkey, I assume there was no treatment, there's no understanding, there's no working on the idea of the addiction. And that impulse, which was not treated, of course, just transferred it, found another way out, as they always do. And so, yeah, moving from gambling to sex, overspending, it's all there. And womanizing. So yeah, I'm very sorry though about the consequence of your family, which is terrible. But I understand, because that behavior is just ramping up into out of control kinds of stuff. But that's a perfect example of how easy it is to just kind of switch. As I said, my primary drug was alcohol. I messed around with other stuff. But I totally believe, never much, but I believe I'm an addict. And the one thing I've never shown any interest in is gambling. It just leaves me cold, but I don't want to try. I don't want to push it, because I'm pretty sure, given half a chance, I could become a gambler. So I just having that awareness, if you're an addict in recovery, just really know that it's really easy to switch. So be cautious.
I'm going to stay with the chat feature here. I'm a gay man and I have an obsession with straight or straight acting men. This has led me to manipulate, overstep legal boundaries, and in general feel hopeless due to my attraction to a group of men that I shouldn't be attracted to. Shouldn't is in quotes there. Do you have any suggestion for an openly gay man who seems to only be attracted to straight men and who wants to be feminized by them? Could I be trans?
Wow, there's a lot packed in there. So first of all, it's not unusual, I think, for gay men to, I guess, fetishize straight men. Part of it is the perceived unattainability of them. It's the same dynamic we see in long distance relationships, where if the fact that we can only get together every couple of weeks because we're on the opposite coasts makes the whole thing hot. When we get together, it's fabulous, and then we apart. I've had clients who finally worked it out where they could live in the same city, and the relationship fell apart because that distancing was no longer a factor. They were accessible. So that's part of it. I think part of it is then sounds like more of an internal process here, where guys do want to see themselves in a certain role, and that part of that role play is with the straight man versus what they want to become. That's all just different kinds of sexual attractions and fetishes and kinks. And, I don't think it's in and of itself a problem, except here it points out, if it's kind of left uncontrolled, where people are starting to cross boundaries and do things that perhaps move beyond the area of mutual consent and on all that. But I think these are the kinds of things, as a therapist, I would, the only way I would treat something like this is if the person themselves is so disturbed by having these feelings. That's what a therapist can ethically treat. We don't try to change people's sexual orientation or their desires or things like that, which we can't anyway, probably. But what we can do is help people work with them so they can accept them as best they can. So yeah, it's an interesting comment. I do see this somewhat. Now, about your last thing, could I be trans? Maybe, I don't know. I do know that there's a whole bunch of gay men who are attracted to straight guys and who want to get in some of this role play of being feminized and all that, who are not trans at all. They're very happy being men in terms of their gender identity, but it could be. This may be a path of exploration for you. I don't think that's the inevitable outcome, but it could be. It could be.
Yeah, I don't think the arousal template, which is what we're talking about here, has all that much or anything to do with gender identity, which is trans versus cis, meaning, I'm comfortable with the body I'm born in, versus trans, which means I like the other body. Very simplified, yeah. But yeah, so I'm with David. Yeah, maybe you're trans, maybe you're not. I don't know. You kind of have to explore that if you want to.
Right.
But yeah,
Right.
I think a lot of guys beat themselves up, particularly sex addicts, about their arousal template, because we're attracted to things that we feel like we shouldn't be attracted to. And what you said, David, we're not going to try and turn a straight guy gay or a gay guy straight, or change the fact that you're a chubby chaser, or because we can't. And it would be completely unethical and actually harmful to do that. It would probably feed your shame to
Oh
try
God,
and
yes.
change your arousal template. So what we want to do is help you accept your arousal template and find ways where you can act on your arousal template that are healthful and not distressing to you. Does that,
Exactly.
I may not have stated that as well as I could have.
No, I think that's exactly right. We try to work with people. The other thing I think I've certainly become aware as I've been working with more heterosexual guys in the last 3 or 4 years is that there's a lot more expansion of arousal templates than I ever knew. So I think, and granted, these are addicts, but I think there's a lot of straight guys that, at least in their addiction, find all kinds of appeal with other men, with transgendered folks, with all kinds of different sexual tastes that come up. Are they gay? I don't think so, but they're exploring, and that's part of their arousal template. But I think we have this idea, very rigid idea about what's appropriate, what's not, and I think maybe if society allows it, in a couple of years, we'll have a much broader idea about the possibilities of human sexuality, because I think it's much more diverse than we allow ourselves to think. I think there's a lot more variety out there that people express themselves that we just don't talk about or hear about.
Okay, let's jump back into the Q&A. My sex addict porn husband, who's about 15 months sober and recently starting to move into recovery. So it sounds like he was white knuckling it for a while. And then the questioner is just starting EFT, which is emotionally focused therapy. The counselor seems to have some knowledge of sex addiction and betrayal trauma, but I feel like I am educating her a bit. We've had one joint session and one individual session each. What are key things to watch for to make sure she's a good fit for sex addiction, betrayal trauma, coupleship healing, while also understanding, as I've heard, that having an EFT therapist who is also experienced in SA and betrayal is a bit of a unicorn. So the individuals and the couple are seeing an emotionally focused therapy counselor, but there's also sex addiction and betrayal trauma to deal with. And is it a unicorn to have somebody who knows how to do both? Matt Wheeler is a unicorn, by the way, or maybe it's Jonathan Taylor. Matt Wheeler. Friday webinar, 2:30. Join us.
I think any therapist can learn and be open and adapt. So certainly, and EFT is a beautiful therapy. It's obviously focuses on emotions and how they affect our human experience. It's not necessarily oriented toward really providing insight to a lot of addictive behaviors in my mind. But I think the beauty of a lot of therapists is that we combine stuff based on our own interests. So, I'm interested in a lot of neurobiology, but I'm interested in addictions. I'm interested in mental health. I do a lot of trauma treatment. So I think we kind of expand our repertoire and have many therapists I know have different modalities. So I think the only concern I would have or caution is if this EFT therapist is strictly operating within an EFT world that may not necessarily recognize or have a lot of understanding of how addictions operate with this trauma base underneath and how they express themselves, and the possibility for what we've been talking about tonight, cross addiction and co-occurring addictions. And it gets kind of complicated, and I think people can get out of their comfort zone a little bit. It's very common for people, for example, like an EFT therapist, to refer to a trauma therapist and sort of to have a colleague they work with. So I think that's another way to kind of make sure that your bases are covered here. But it's totally legitimate. You're asking what to do. It's totally legitimate to ask your therapist what their understanding of addiction is and how much training do they have in it and what's their approach. And I think that's really important and essential, actually, for a client to understand, is this therapist on the same page as I am? And in terms of understanding me, because And I found patients or clients are just unbelievably polite sometimes and sit there without questioning, without saying something, without collaborating. I think a therapeutic relationship really needs to be collaborative. For far too long, we've been the expert, and yeah, I'm an expert in that I know stuff. I may know a little bit more than the person sitting with me, but therapy, I think, has to be collaborative, right? It has to be a team effort. So I would ask and see, and it might be a good fit, and it may not, just depending on the breadth of knowledge of that particular therapist, no matter what school of thought or orientation they come from.
And just ethically speaking, a therapist should tell you, I don't really know much about sex addiction. Would you like me to refer you to a CSAT and stay with me for the EFT part, for maybe couples counseling? I mean, they either need to educate themselves so that they can understand your world, or they need to refer you to someone who understands your world and maybe work with you on their specialty. So you may need to bring a second therapist into the equation.
Right. But I'll tell you, the sex addiction world, including the idea of betrayal trauma, is very highly specialized. And I think even other addiction specialists would have a hard time dealing with some of the nuances of sex addiction and porn addiction, and especially betrayal trauma. I consider myself pretty well versed in terms of addiction treatment and sex addiction and porn addiction, but I'm really careful about betrayal trauma because there's a lot of nuances there that I'm not that familiar with. That's a whole other specialty. So I think that idea of really knowing the limits of the scope of practice that you're comfortable with, and then exactly what Scott said, making a referral, and it takes a therapist to say, okay, this is where my knowledge stops. Some people can't do that, unfortunately, but it's really, really critical. And that's why it's really important for the client to kind of know what are the options here? What kind of therapist might be helpful in this situation? And am I getting that kind of therapy? Really important questions.
Yeah, if I have cancer, I'm not going to my dentist to get it fixed.
Right.
I'm going to find an oncologist. And this is kind of the same thing. You got to go to the right doctor.
For sure.
Do addicts have any boundaries? My husband sought control in a threesome and engaged with the man. I feel like he is bi. That's 6 different things going on in those couple of sentences.
Okay, well, an addict in the throes of their disease probably doesn't have a lot of boundaries when it comes to certain behaviors. I mean, there are some, but I think they start to get pretty permeable as the addiction proceeds. So here it is again. My husband sought control in a threesome engagement with the man. This is not that uncommon for a lot of sex addicts. And as I said earlier, I don't think that means your husband is bi or gay or anything else. I think this was behavior that was driven in the moment by addictive processes that got expressed with a living person. Sometimes with that joke about anybody with a pulse, or sometimes not, right? It's just people get there's a bunch of elements going on here. There's the excitement factor, right? The kind of new, the novelty, the difference, the taboo. All those elements are like accelerants in this process. And I think if you're in the addictive mindset anyway, and there's this opportunity to kind of break some taboo or explore something that you never did before, that has a certain appeal. I don't think it reflects necessarily any kind of underlying issue of sexual orientation, personally, but in general.
I mean, if this has been going on a regular basis since he was 15,
yeah.
Maybe we have something else to talk about.
Yeah.
I recently learned that hypersexuality, a term we don't particularly love, but sex addiction, let's just call it that, I'm sorry, this is why we don't love it. Hypersexuality is a symptom of bipolarism. That's why we don't call sex addiction hypersexuality, because hypersexual behavior can be a symptom of things like bipolarism, particularly the manic phase. So thank you. So, okay, I'm going to start over. I recently learned that hypersexuality is a symptom of bipolarism. My husband has been acting very erratically in his recent relapse, not just sexually, but also in other aspects of his life. His father has bipolar disorder. There's concern that my husband is showing signs of it. He is currently not in treatment. If he ever comes around to seeing his CSAT, should this be brought up to the therapist? Yes, 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 yes. Or should we wait for the therapist to make their own assessment?
Okay, so in general, for anything, I think the more you can inform the therapist, the better, and not wait for some kind of discovery process because bad things could happen. One of the things therapists should do, but it really does help to get the information from family, is to kind of rule out. There's this differential diagnosis process we go through. And so if we look at behavior, like a lot of compulsive sexual behavior, crossing boundaries, kind of out of control, all that stuff. If I'm a sex addiction therapist, I probably assume it's a sex addiction. But what I'm also thinking and looking is I'm ruling out what else might be going on here. And I know that exactly as you say, the manic phase of a bipolar process looks very much like sex addiction in that people are acting out in a very manic way, a lot of hypersexuality, a lot of poor boundaries, acting out, impulsive control, all that stuff. I also look at organic stuff. Is there certain kinds of behaviors can be affected by a nodule or a tumor or other kinds of things. So we have to really be careful about, or even anti-Parkinson medication. People who are on any kind of levodopa or the dopa-based medications for Parkinson's, what do? They increase sexuality, kind of like meth, by the way, same chemical thing going on there. And so, yeah, we have to rule out all these causes. So we're matching the correct treatment to the problem. If somebody goes through sex addiction treatment, but their cause is really bipolar and that's not caught, and I would like to assume that we would always catch that at Seeking Integrity, but I know a lot of places don't. Then we're missing the mark because that person needs to be on medication. And if there's a family history, that's another warning sign. But I would definitely, no matter what, I would get a psychiatric consult just to see where you're at.
Yeah, I'd get a full psychiatric assessment.
Yeah.
And then a CSAT assessment. And it's possible to be both bipolar and sex addiction. If you get the bipolar under control with medication and the hypersexual behaviors continue, it's quite possibly that you're dealing with sex addiction. My husband is the opposite of the extreme jealousy, sex addict for 44 plus years and never shown any level of jealousy. Could this be a result of his 44 years in sex addiction?
Yeah, again, it's a really complicated scenario because you get kind of basic personality types, you get other kinds of thought issues, even thought disorders sometimes. And then, I don't know, I think I'm just going to say no, because I'm not sure. There's so many factors this could be. 44 years of sex addiction is a long time. And what that does is really mess with levels of sexual desire, levels of interest, levels of the ability to attach and make emotional connections. I mean, a lot of things get out of balance and impaired. And so, I mean, those behaviors of never showing any level of jealousy, I wonder, does that also mean never showing levels of interest, emotional connection, attachment, all that stuff? That's all, I think, more directly related to sex addiction and the consequences of it than perhaps jealousy or lack of it. But it's hard to say. It's really hard to say. But 44, well, Gary, I'll say this: 44 years of sex addiction is going to cause a lot of problems in a lot of life areas, for sure.
Yeah, there's actually a follow-up to this. I feel as if my husband put me in a box with the lid on it many years ago. He escalated his compartmentalizing. This was something I had felt for many years before I discovered that he was a sexual porn addict. Once discovered, it was obvious how extremely disconnected he was to me. It was as if I was a stranger to him. Can you speak to this, please?
Yeah, this is really, really great observation. And so what happens with sex addiction, with any addiction, really, we compartmentalize, right? That's a classic hallmark of addiction, where we take this behavior and we kind of tuck it over there and wall it off. So I have this nice presentation for the public. Perhaps I'm going to work. I'm an upstanding member in the community and blah, blah, blah. But I have this whole secret kind of sordid life off in the shadows that that not many people know about, if anybody. And just we compartmentalize our lives in these areas. And that's really classic. And so like this, even though it's astonishing, right? After so many years, you discover this very ingrained, deep, dark behavior. And we've seen this a lot, where guys can do this for years, and their wife is unaware of it. And so, yeah. And when we do this, we speak of sex addiction as an attachment disorder or an intimacy disorder. What that means is that people typically have a hard time forming attachments in which, and what is it? What do I mean by attachment? I mean an intimate human connection, and that has to do with oftentimes trouble feeling vulnerable and an inability to trust. I mean, there's a lot of issues that are necessary to form healthy attachments or relationships that a lot of addicts, especially sex addicts, are somewhat deficient in. And so part of the treatment is actually learning how to do some of that and develop empathy and learn how to connect to people and be vulnerable and trust and express. So I think there's a lot of that's going on. And when when those relationships are awkward, when it's hard to make out emotionally, to connect with people, it's easier sometimes for the addict to go into that box. What happens in there? They're in their addiction, they're in control. There's no risk, there's no vulnerability. They're in control of the whole show. And I think that becomes kind of an alternate universe that people kind of like to spend their time in, much to the dismay of the family that they think is around them, because those people are kind of left disconnected, and it feels that way. And that's, I think, what you're experiencing. So that, by the way, I think addicts compartmentalize, as I say, that's inherent probably before we ever pick up our first drink or see porn for the first time. We've usually, based on trauma, we know how to compartmentalize. So we know how to do that. But I think all that stuff can be repaired with good therapy. So I don't think even that long, I don't think that indicates that it's not something you should be hopeful about fixing.
Yeah, and I think it's really, really common for addicts to be disconnected from everyone and everything. That's the whole point of addiction. If I'm not connected to anything, I can't get hurt. What happens for the addict is eventually the world gets smaller and smaller and smaller,
yeah,
and it becomes miserable and lonely, and there's no escaping that. I mean, that's really what happened to me. It was just one day I was like, there is no one and nothing in my life because I won't allow anyone in. And I had to make some changes. And the 12 steps, by the way, are wonderful. They're set up to teach addicts how to let people in a healthy way. Steps 4 through 9 are fabulous. So 12-step recovery, big fan. Somebody asked what CSAT means. CSAT stands for Certified Sex Addiction Therapist. If you or someone you know needs a CSAT, contact us at sexandrelationshiphealing.com or Seeking Integrity. Either website, just hit the Contact Us button. It goes to the same place. And tell us you're looking for a CSAT in your area. We will help you find one. We know who the good ones are. Sometimes you don't have a lot of choice, but if you're in New York or LA or someplace, we know who the good ones are. We will point you toward the best people, and we're happy to do that.
Great.
I've been trying to figure out the reason why I have a hard time, this is from the Q&A here, giving up meth and sex. It seems tonight's topic of addiction relates to trauma as the root cause. I don't recall or believe I've experienced any trauma growing up or that I used to escape from pain, only for the euphoric high one gets from Chemsex. What other root causes or possibilities that I can explore to get to the bottom of what my problem is? Great question.
Yeah, great question. And I think I'd encourage you to look at that idea of neglect I spoke of before, that lack of emotional attunement, that because it's something that wasn't there. And it's harder to recognize that something was missing especially if it seemed like it wasn't because you had material goods and stuff. So that's one aspect. The other thing, and this may be another form of trauma or not, but I think a lot of times the guys that I see who are using meth and other drugs combined with sex there's a lot of shame issues, shame, internalized shame, a lot of self-loathing, a lot of fear of not being good enough for whatever reason. Maybe there may be chronic bullying. We know that, by the way, trauma therapists talk about trauma with a capital T, which means kind of the major trauma events, the war injury, the car accident, the natural disaster. But there's trauma with a little lowercase t too. What is that? That's bullying. That's some of the neglect. It's some of these chronic kind of low-grade issues that don't in and of themselves rise to the level of a trauma with a capital T, but over time, they have the same result in that this development PTSD and other kinds of trauma just from the sheer accumulation of the traumatic experience. So I usually think there is trauma there in some form, but other times I've seen shame, other kinds of really strong feelings of being put down or neglected result in that as well.
Yeah, trauma, when I got into recovery, if you had asked me if I'd ever experienced any trauma, I would have said, no, of course not. We did a little digging and it was like, oh dear. A couple books to read, Enid Gray's book called Neglect, The Silent Abuser, Christine Courtois' book about trauma called It's Not You, It's What Happened to You. Those are really good ones just for seeing if you identify with anything that pops up. And also Ken Adams' book, Silently Seduced, which a lot of male sex addicts find they identify with, including myself. Enmeshment, neglect, all this stuff that we don't identify as trauma can be really traumatic, and it can create a lot of shame. Yeah, I guess there can be other root causes, but we don't really see that very often, do we, David?
Not so much. Not with the people we treat, really.
It's just probably a matter of digging a little deeper, which is no fun, by the way. We've used our time. Thank you, everybody. Great questions today. Great topic today, David. I'm glad we were able to cover this. This is your specialty, and I feel like we never really address it head on as a topic.
Yeah, we talk around the edges, but head on we don't. It was a pleasure to do that tonight.
So I'm glad we did that tonight. So thank you, everybody. We will be back next week, same time, same place, and we'll see you then.
All right. Good night, Scott. Take care.
Good night.